For more right now on the frontline fight against COVID-19, let's welcome Dr. Zeke Emanuel. He is former Obama White House health policy advisor. He's now the vice provost of global initiatives at the University of Pennsylvania, and he's the co-host of Making the Call podcast. Dr. Emanuel, it's great to see you. Thank you for joining us.
Nice to be with you, Becky. Thank you for having me.
There are all kinds of questions about what comes next when we start to open up. That national stay-at-home order ends on April 30th. What do you think the country looks like on May 1st?
Hopefully it'll look pretty much the same. I don't think we're ready to open up. I think we need several indicators. The first indicator is we need new cases of COVID-19 in the areas that we're going to open to drop below about 20 per million population per day. We're not at that level in most parts of the country. Some parts of the country are or likely to be at that level, like the Seattle area. Second, we need an infrastructure, a testing infrastructure. You were just talking about the testing. We really need to be doing millions of tests a day. Right now, the CDC recommendations for doing tests are mainly focused on who to treat and who to tell that they have COVID-19. But if you want to actually open up the economy, you need to actually have a test that is looking to lock down the spread and prevent more spread of the disease. And that tests a different population. That tests frontline healthcare workers, frontline grocery workers, people with a lot of exposure to other people, people who might be what have been called super spreaders that happen to connect with lots of different people that may not know that they're infected. And that takes many more tests than just the 100,000 we're doing a day, roughly. And I don't think we've got that infrastructure.
Meg just mentioned. Well, Meg just talked about the testing and the number of false negatives, false positives. How can we possibly reach that when you can't even guarantee that the test results you're getting back are correct?
That's a serious problem, but let's analyze it for your viewers. You know, having a false positive, thinking someone's got COVID from a spread standpoint, that's not that bad a thing. It's really bad for the person. They've got to sit for 14 days in isolation, et cetera. But from the spread standpoint, the real worry are the false negatives, the case where you say someone, you don't have COVID-19, and yet they've got COVID-19 and they're still walking around talking to people or going to groceries and maybe putting their hands on various Frigidaires and things and leaving their virus. That's the real worry from a spread standpoint. And so you're absolutely right. We do need to make sure these tests are better calibrated. And we do need to make sure that the false positive rate is very low. And that's really, really important. I think the way we need to begin thinking about it is we need a mass screening test that's easy, may have too many false positives, but then you have a PCR which has very well calibrated and can really sort out who gets it. That's probably the place we're going to go. How fast we're going to get there, that's, I think, really important from the perspective of easing the physical distancing measures we have. Because if you don't have this testing capacity in place and can't do 1 million, 2 million a day, it's very hard to see how you're going to ease up. Because if you want to ease up, you have to reduce the number of spreaders.
You're somebody who has worked in an administration, in the Obama administration, and we are starting to see some pushback from people in places where they don't feel like the spread is all that bad, where they don't have a lot of cases, where they are really frustrated and hurt by the economic pain that they're suffering under this shutdown, who are starting to push back. And you're seeing this, again, in the middle of April, before we even get towards the end of April. What is the political will going to be for maintaining these very strict measures that are working, but that are very painful from an economic perspective?
Look, everyone feels everyone's pain. It's very important to understand the pain, and we really do have to minimize the economic damage. That means you need a whole infrastructure for addressing this issue. And I would say it really reflects political leadership. I don't think the country has gotten a very clear perspective on what are the measures we're looking at, what are the steps we're taking to put those measures in, like a testing infrastructure, contact tracing infrastructure, in place so that we can address this problem. What are we doing to make sure that people who are older, people who have comorbidities, whether it's diabetes or high blood pressure or cardiac disease, are actually being protected the way they're doing a very good job of in Germany. And I think that's part of the problem here. Yes, we need to open the economy. Yes, we need to have certain measures in place to do that in the safest possible way. The American public has stepped up. We've done physical distancing really well. We can see that in the numbers of new cases, in the numbers of hospitalizations. And now they're waiting. Well, what's the next step we have to do to begin opening up the economy? And it's hard to hear from the leadership what those measures are. And I know that a lot of state governors are scrambling to get a testing regime in place so they can do exactly what you said.
Right. Hey, Zeke, want to talk to you about what I think is the ultimate conundrum. And I spent yesterday on the phone with a number of scientists about this, which is children and schools, and really the issue of whether and how to reopen, especially children that are younger, given that they come home and it's a contact sport. The ability to have them be disciplined and wear masks and wash their hands is almost impossible to believe. And so how do you handle that from a public policy perspective? Because the flip side of it is if the kids can't go to school, the parents perhaps have to stay at home, and you have a real conundrum in terms of trying to get the economy back on its footing.
Look, I think I was an early advocate that kids should be able to go back to school, assuming that their parents understand the risks and understand the problem. You know, we still don't know whether they're big spreaders of this disease or not. We know that they don't suffer seriously from it, and that's probably a risk worth taking. And I do think we need to actually have a situation where they can go back to school. Remember, you're then going to need teachers in those schools, and part of what we need, the teachers have to volunteer, knowing they're taking risks too. Same thing with administrators, the food service workers, et cetera. But I think that's something to look at, because you get a lot of immunity if kids get exposed, and then you can actually, but parents have to understand the risks that they would be taking if, God forbid, the kids did get COVID in school and bring it home. But I think, you know, again, this is part of the rationale or thinking through of what are the risks we're worth taking. Can it be done on a voluntary basis where parents are going to permit that, recognizing that there's some risk that the kids will bring COVID back home and they will have to be isolated. Everyone will have to be isolated for 14 days.